So photobiomodulation is what we used to call low laser therapy. And the main question that, thank you. The main question that we are addressing here is whether or not this type of therapy is protective of the tumor cells. This is a disclosure. James Carroll, who is a co-author, and he's an optical engineer and participating in this study. He is the founder and CEO of Thor Photomedicine. There are no other disclosures to make. So here's the background. Photobiomodulation, or PBM, has been used in cancer patients to prevent and/or treat therapy-induced mucositis or dermatitis. The first time I used this instrument was in 1994, and we published our results, and they were actually positive. And since then, myriad studies have been published with what I think are robust results, robust and consistent results, saying that photobiomodulation is able to prevent and/or treat both chemotherapy-induced and radiation therapy-induced mucositis. There have been some articles, all of them in vitro, that have suggested that photobiomodulation may protect malignant cells from the effect of cytotoxic treatments. That obviously is a concern. You don't want to save the patient from mucositis and let the cancer cells grow, at least not ideally. And our previous data, a study that we published in 2016, suggested there is actually a dichotomous type of response for cells exposed to photobiomodulation, and that consists of normal cells being protected and cancer cells actually being sensitized. We had more cancer cells that were pre-exposed to photobiomodulation die when they were exposed to radiation therapy than those in the control group. There is a paucity of studies in vivo addressing this hypothesis. So here is our hypothesis. Based on our in vitro results, we hypothesized that photobiomodulation exposure of oral cancer tumors in an animal model will enhance tumor response to radiation therapy. The null hypothesis was that pre-exposure to PBM will have no effect or result in tumor protection from the killing effects of radiation therapy. We did 3 experiments. In experiment number 1, we used the typical number of cells, which are a human oral cancer line that were injected in the tongues of nude mice. These are immune incompetent mice, and were checked with bioluminescence for viability. Tumors were allowed to grow for 7 days or 1 week, whichever came first. Animals were divided randomly into 4 groups: control group, photobiomodulation only, radiation only, and photobiomodulation plus radiation. There was also a group of Republicans, but those died very early. Photobiomodulation consisted of a single exposure to 650 nanometers of light at the power of 75 milliwatts, and a fluence of what I thought was 5.6 joules per centimeter square, but James corrected that thing a little bit too late for me to add it for this presentation. Turns out that it was about 17 joules per square centimeter. And we used a Thor LX2 instrument, which is fabricated by Thor Photomedicine. The animals were treated with a daily dose of radiation, 4 grays per day for 5 consecutive days. And the total was 20 grays per animal. Experiment number 2, the same type of animals divided into the same groups. PBM consisted again of 650 nanometer wavelengths light at 5.6 joules per square centimeter, which James told me again there were about 18 joules per square centimeter. So don't believe a word I say. Radiation therapy consisted of 1 single dose this time, so no longer 4 daily doses, but 1 single dose of 15 grays delivered 30 minutes after the PBM exposure. Experiment 3, the same animals, well, the same type of animals, were divided into groups as previously described. The PBM this time consisted of a combination of 650 nanometers and 810 nanometer wavelengths at a power of 1874 milliwatts and a fluence of 3 joules per square centimeter. The radiation therapy consisted again of 15 grays delivered in a single dose 30 minutes after the PBM exposure. All animals in all groups were weighed daily and tumor behavior was evaluated with TV fluorescence. These are our results. There were basically no differences between control and PBM-only animals, suggesting that there was no PBM stimulation or inhibition of tumor growth. So these are when you compared the control group with the PBM-only group. We found no difference whatsoever. Animals exposed to radiation therapy had significantly lower TV fluorescence scores as expected and longer survival as expected, regardless of exposure to PBM, as expected but not desired, suggesting that there was no interference, however, of the PBM with the RT effect on the tumors. Radiation therapy plus PBM animals lost significantly less weight than all other groups, again suggesting that there is a beneficial effect of PBM on mucositis, inflammation, and other type of changes that would prevent an animal from eating properly. These are the Republicans who died early, but we also have them as animals here, and you can see the results that we had in graphic form. This is the TV fluorescence, and these are practically all animals having tumors. At 7 days, some of the animals have died, but you can see clearly that the tumors have shrunk significantly in the groups that had received radiation therapy. And from here on, I'm not showing anymore the control group or the PBM-only group. This is the PBM plus radiation versus PBM alone. And you can see that actually the behavior is fairly similar, with some of the animals in the radiation group and in the PBM plus radiation group showing no tumor growth at 20 days. At this point, actually, we had significance. At 20 days, significantly more animals the animals from the PBM plus radiation therapy had significantly less TV fluorescence than the animals from radiation alone. This is at 27 days. No significance from a statistical point of view here. And this is at 34 days, where actually 3 of the animals in the PBM plus RT continue to be disease-free. This is pretty much the same thing, but in a different kind of colorful explanation, where you can see the results at 20 days being statistically significant, but not reaching statistical significance at any of the other times. And pretty much the same thing. So here are our conclusions. Based on these 3 experiments in the orthotopic animal model, we believe that this is a strong suggestion that photobiomodulation has no proliferative or protective effects on human oral cancer tumors in a head and neck orthotopic animal model. We were unable to show a sensitization effect, unfortunately, which I was counting on. So we saw no sensitization effect of the cancer cells to radiation therapy by photobiomodulation. And we believe, or at least I theorize, that it is because these animals did not have an immune system. I believe that actually the effect of PBM in enhancing tumor response to radiation therapy is modulated by the immune system, and since these animals had no immune system, you could not see such effect. And animals exposed to PBM and radiation have maintained their weight better than RT alone peers, suggesting protective effects of PBM on normal mucosal cells, which again has been proven many times and has been expected as one of the results of our study. And with this, I thank you, and I guess I can take questions.